Good afternoon, everybody. I'm Councilmember Cam Gordon. I'm Chair of the Health, Environment, and Community Engagement Committee, and I'm calling this meeting to order. This is our regularly scheduled meeting, and today I'm joined by Vice Chair Andrew Johnson and Councilmember Jacob Fry and Elizabeth Glidden. That's a quorum of the committee, and so we can get started. We have 5 items on our agenda today, 2 consent items and 3 discussion items. First, I'll move forward with the consent items, and any committee member who wants to pull something off, we can do that for questions or discussion. The first item is approving the appointment of Fartun Wheely from Ward 8 to the Public Health Advisory Committee for a term beginning immediately and ending December 31st, 2017. And the second is authorizing an amendment to an agreement with the Minneapolis High Rise Representative Council, increasing contract with them by $70,000 for a revised contract not to exceed $150,000 to continue to provide chronic disease prevention and management services. Anybody want to pull any of those off for discussion? Seeing none, then I will move those 2 items forward for approval. All those in favor, please say aye.
Aye. Aye.
Any opposed, say no. Those motions carry then. And then we'll move on to our discussion items. There's 3 of them. The first is about the blueprint for action to prevent youth violence. The second is the Minneapolis Skyway Senior Center. And the last one is about a cooperative agreement for energy efficiency pilot projects. So for item number 3, I believe we're going to have Sasha Cotton come up and give us a presentation. This is our annual report about the youth violence prevention work. And I just wanted to let my colleagues know that in addition to the report today, about mid-November, I think on the 14th, there'll be a Results Minneapolis report looking at youth violence prevention. And after that, we'll also get that report. My plan is to have that presented to the committee too, so we'll have 2 opportunities this fall to dig into this a little bit more deeply. And with that,
Hello.
Are you ready? Welcome.
Thank you, Council. We look forward to presenting not only today, but as Councilmember Gordon said, shortly for our Results Minneapolis, which will have more detailed data in it. So we will get started. I am Sasha Cotton, the Youth Violence Prevention Coordinator in the city's Health Department, here to talk about the Blueprint for Action to Prevent Youth Violence. Slide, please. Just a little bit of backstory and history. The Blueprint for Action to Prevent Youth Violence was commissioned by the City Council of Minneapolis in 2008 and has been led by the City Health Department. Our activities focus on planning and service coordination with our jurisdictional partners, and that's largely our partners here in the city include MPD and Minneapolis Employment. We work closely with the county as well as Minneapolis Public Schools and community-based organizations. We provide technical assistance to community-based agencies, and we do data analysis and new program development to address service gaps. Slide, please. I wanted to highlight a little bit information about the public health approach to prevention. I think it's an important framework for the council and others to think about as you begin to evaluate our work and think a little bit about how we do what we do. 2 very important tools are the pyramid of prevention, and the other one is the spectrum of prevention. The pyramid in particular is a huge guiding point to how we do our work. We have focused historically on primary and secondary prevention because, as you can see, the base and second layer of the pyramid are where the largest population can be served. So many of our programs have really focused on those 2 layers. As we're moving forward into 2017, and I'll talk a little bit more detailed about this later in the presentation, we're beginning to really sink our teeth into the tertiary work and really think about how we can work with young people who have already been impacted by the violence. So to back up a bit, primary prevention is really thinking about how we can work with young people before violence has happened to help them avoid having that experience. Secondary prevention is really what many of us would think of as intervention. It's how we get involved when we can see some risk factors or some concerns for young people that we want to address before it becomes a chronic problem. And tertiary is really thinking about how we can reduce ongoing patterns of violence, knowing that young people who have experienced violence are at great risk for having continued patterns of violence as a part of their life. Slide, please. Our work, again, is broken out through primary, secondary, and tertiary. Primary is our first 2 goals. So we foster violent-free social environments, and we promote positive opportunities and connections to trusted adults for all youth. Our secondary prevention framework is to intervene with youth and families at the first sign of risk, and a large body of that has been in the programs that we've developed to this point. And then tertiary prevention, our goals revolve around restoring youth who have gone down the wrong path and protecting children and youth from violence in the community. Slide, please. I did want to give you a little bit of a preview into some data. So our data goes up through 2015. We've had a decrease in violence, but we certainly feel like we have work to do. And so we are going to talk a little bit about the programs that we're designing to help address the pattern of violence. Next slide, please. And then this slide is about gunshot victims. And a little later in the presentation, we'll talk about our Next Step program, which is designed to work with young people who've experienced gunshot experiences.
Could I just ask about this slide? Are we already anticipating a greater increase in 2016 than we saw in 2015? Do we know, or are we on track?
I believe that our numbers are relatively the same for 2015 and 2016, but I can certainly check that and get back to you.
Okay, I just know that we get regular reports from the police department on gunshot victims and gunshot wounds, especially, and it seems like there's an increase, but
yeah, I think in certain parts of the community we're certainly seeing an increase, but citywide our numbers, I believe, remain about the same.
Okay, thank you.
Slide, please. Our primary prevention activities primarily focus on community engagement and public education. Slide. The picture that you have in front of you here is from our Bridges to Manhood conference at MCTC, which is a part of our National Youth Violence Prevention Week. The conference is designed for young men and boys of color to really focus on providing them with training and education about life skills. So there's some employment training, there's some access to education. The picture here comes from our tie-tying ceremony. We know that in many communities, particularly communities of color, there's a high rate of fatherlessness, and that many young men don't own a tie and haven't been exposed to how to tie a tie, which we know is so crucial for job interviews and other important dates. And so a crucial part of the experience is a tie-tying ceremony. You can see the guy who's in the front with the watch is a gentleman who works for a charter school. And so we have table hosts at each table who help young men learn how to tie a tie. We provide each young man with a tie because we think it's really important for young men to own a tie, to be able to go on job interviews and to school interviews. So we feel like that's a really important part of that week. It's a hallmark that we've been developing. So this is our second year. The first year we did it at the University of Minnesota, but this year we partnered with MCTC. We felt like it was important for young men to be exposed to the college environment, and MCTC was a great partner. Throughout the week, we offered 10 activities, including a 3-on-3 basketball tournament in North Minneapolis, as well as some engagement and faith-based activities, both on the north and the south side. So it's becoming a hallmark to our work to really increase the visibility of youth violence and really, I won't say reward, but congratulate young people who are making good choices and plug into the young people who maybe need a little bit more support. So we try to focus on having our programs in community-based agencies. We partner with them to provide services so that young people can get a better understanding of what some of our partners can offer, such as Emerge and Pillsbury are some of the partners that we worked with this past year in 2016. Slide.
Councilmember Johnson has a question about that, I think.
Thank you, Mr. Chair. I actually grew up without a father, and so obviously this is an important topic, I think, to have those male mentor opportunities within the community. So are you currently partnered with Big Brothers and Big Sisters in order to provide youth with ongoing male role models in their life? And if so, what are the numbers that we've helped boost Big Brother and Big Sister connections?
So we have a relationship with Big Brothers and Big Sisters, but we're not necessarily a partner in the sense that we have an MOU with them. They did table at our events during Youth Violence Prevention Week to make sure that young people were aware of those services. But we have an in-house case management program that I'll talk a little bit about later that matches young people with mentors.
Gotcha. Okay. It seems like an opportunity. I know they're a great organization, so I look forward to hearing what we're doing, but just wanted to also point out that they're a really great organization that is able to provide a pipeline to a lot of volunteer adults that are able to mentor children. So I hope that we look for every opportunity possible to work with them and ultimately to connect more kids up to those experiences.
Thank you. We certainly will talk further about that at another opportunity. We can certainly get you some more information about our relationship with them and have conversations about any ideas you might have to increase that relationship. Next slide. Our pop-up parks are also another hallmark of the work that we've been doing. They're really designed to engage young people in high-risk communities. We use street intersections, parks that are underutilized, as well as vacant lots to provide a safe space for young people, particularly in the evenings from 4 to 9 when we know that young people may be not engaged in pro-social activity. The pop-up parks have been a great extension of a partnership between the city and the Park and Rec Department, which we've really enjoyed working with them and being able to provide that service. The quote here is from a mother, actually, who went on to talk about how she didn't really feel safe letting her kids play in the community because a lot of the time she just feels like, you know, there's not enough adult supervision and things go on in our parks that she didn't feel comfortable letting them go to. But when the pop-up parks are present, she felt as though it was a safer opportunity. So that's just one way that we're getting some feedback from parents and families about the pop-up parks. We are also doing some work around preventing childhood exposure to violence. So in 2015, the city's health department put together a work group specifically focused on preventing childhood exposure to violence. We've provided some community-based trainings about the impact of trauma on children, particularly as it relates to their outcomes in adolescence. What we know from research is that when young people are exposed to violence, whether that be in their communities or in their homes, their likelihood for being a victim or perpetrator in adolescence is increased. And so we really feel like it's important to work with providers, but particularly with young parents, around how trauma can impact their children and try to give them some tools and skills on how they can avoid that violence. We just recently put out some grants, 6 micro grants to work with young parents, for agencies to work with young parents on exposure to violence for their children. So we're really excited to see how those grantees roll out their projects that will end in the January of 2017. The next phase of our work is the secondary prevention. Slide, please. Inspiring Youth is that case management service that we talked a little bit about that provides young people with both case management and mentorship services. It's designed to engage youth who have been identified as having a high risk for involvement with violence. They're assigned one-on-one case management who provide support in school, the community, and with their families. They also serve as a mentor and a trusted adult for youth, which we know is a critical part of our work with the Blueprint. And that service is provided through a contract with the Tubman Family Services. Slide, please. Parent support. We also recognize that.
We have another question,
Yes.
Councilmember Johnson.
Thank you, Mr. Chair. Just going back a slide, I'm wondering, do you have the metrics for how many youth have been served by the mentors, how many we've been able to connect up?
Sure.
Is that later in the presentation?
No. In 2015, 65 youth were served through Inspiring Youth, and we're looking to increase that amount through the SAMHSA grant. So we just got funding to be able to provide those services to another, hopefully another 65 youth this year.
And are those, how many case managers do we have?
Currently, we have 2.5 people working as case managers. We're looking to increase that to another full-time position to be able to provide more services.
Okay, thank you.
Thank you.
Hey, could I just ask?
Yes.
Is this our second year or our third year of
2016 is our second year.
Second
2015 was the first year.
Okay. And are we measuring in terms of the results that we're getting? Not just the number of youth we serve, but how many stay out of trouble or go on? And I know only 2 years is very little to measure, but.
Sure. We are measuring their success. That project is managed by Josh Peterson, and we will have more metrics on that at the Results Minneapolis
Okay, great.
presentation. Through our parent support program, we offer 4 parent support groups. We know that parents of adolescents often struggle with parenting, particularly for young people who have demonstrated risk for violence. And so one of them is through the link, and it is currently provided to families whose youth have already been involved in the juvenile justice system. The other is at Brian Coyle, and it's specifically for single moms who are raising sons from the East African community. And then the other is Goodwill Easter Seal, which is engaging fathers who have been disconnected from families and really trying to get them re-engaged in the parenting process. We know that it's really important for families to have as much support as possible, particularly when raising adolescents. So those are the agencies that we're currently working with to provide parent support.
Councilmember Johnson.
Thank you, Mr. Chair. I think these are great things. My question is, obviously, Hennepin County has a huge role to play in this with their administration of the juvenile justice system. I know they have a lot of support programs available. How does this fit into that larger picture of what Hennepin County is doing? And are we just filling in a gap? Are we working with Hennepin County on this? Are we providing services that they aren't providing? And what's that holistic picture around their work and our role?
Sure. So primarily the parent support that's offered through the county is a part of a court order. It's something that for young people who have been involved in the juvenile justice system, and it's a part of their probation or case management. These are voluntary for families who feel like they need some additional support but haven't necessarily gotten to the point of it being at a court order.
I appreciate that. So right now the county doesn't offer any sort of voluntary support. It would be great if we could work with the county on this, because this is a great program for Minneapolis parents, but I would hope that the county would also roll it out or follow suit on this and help ensure that the other cities in the county are offering this as well. Thank you.
Yes, thank you. We will certainly raise that with them the next time that we have a chance to speak with them. But thank you for letting us know, and encourage them yourself too to think about how we can be more inclusive and expansive around parent support. We know that it's really important for young families in particular. Next slide, please. This is a slide about the Juvenile Supervision Center, and we know that you recently had a presentation about this, but wanted to just go over some of the numbers. Can you go back to my notes, please? In 2015, we serviced 1,775 youth in the Juvenile Supervision Center, and the map demonstrates largely where the young people reside who were brought to the Juvenile Supervision Center. As I'm sure many of you know, it's a non-secure place where we can bring young people when they've perpetrated a low-level crime, and we don't want them to experience the trauma of going to a secure location. It also provides an assessment and some case management opportunities for young people who need some additional support through the link. So that is our Juvenile Supervision Center, which we've been doing for many years. Next slide. The Blueprint Improved Institute is a relatively new project. 2015 was our first year that we piloted it, and it is designed to provide capacity building to small community-based agencies. We know that some of the folks in our community who have a great passion for young people and who have maybe been troubled youth themselves in the past are now trying to give back and really want to be able to provide concrete services to young people. And often they apply for funds at the city or state level, and because they don't have a particular skill set like grant writing or the development of logic models, they're unable to get the grant funding that they need to provide services. And so what we're trying to do is improve their ability to do those things and provide them with a small micro grant of $3,000 to demonstrate what they've learned, so that we can build their capacity to provide to apply for not only city dollars, but also state and federal dollars. Two of our agencies from 2015 have been able to go on and apply for foundation funding and are now working based on foundation funding. So we're very proud of that. And one of them was actually written into our current CDC grant that was just received to do some teen dating violence and youth violence prevention work. So we really feel like we're seeing some great outcomes from our first cohort who are really being able to do some work in the community with some increased skill. Next slide, please. Next step is our hospital-based intervention program. It was launched in 2016 in July. It's a partnership between the city, Hennepin County Medical Center, and it's focused on young people ages 12 to 28 who are treated for violence-related injuries at HCMC. It's a bedside intervention where we are able to provide youth development workers to really engage with young people right there at the hospital when they've come in for a violent injury. And it seeks to reduce re-injury for young people who are coming in with violent crime injuries. And we're very fortunate today that we have Farji, I want to make sure I get his last name right because that's important, Shahir, who is one of the youth development case managers with the Next Step program. He's here to share a little bit about his experience and how the project is going thus far. So I'll invite him to the podium.
Thank you, Chair.
Wonderful. Welcome.
Thank you, Chair, members of the Chair, for having me here to kind of explain what's been going on. I'm not sure if you guys are familiar, but Next Step deals with violence intervention. Patients come into the hospital who are dealing with pretty significant wounds, like the gunshot wounds, stabbings, or the violent assaults. When these young people first enter into the hospital, they are kind of hopeless, but then they meet case managers like myself and my team member, Connie. Unfortunately, there's only two of us to kind of provide this service to the youth that we have at the hospital. But once they actually meet us after that initial meeting, a lot of the young people are interested in making changes in their lives. By us meeting them at the hospital, we catch them in a vulnerable state in which they are kind of questioning some of the things that they are doing with their lives and how can they improve their lives, because a lot of them are actually brushing close to death. They come in, we're alerted when it happens, what side of the city it happens on, if it's gang related or if it's just an innocent bystander. The one thing about the violence intervention team is that we are now trying to address this kind of cancer, because what happens is it's not only the shooter and the person that gets shot that's affected, but it's also the family members, it's also the community members, and it's also the shooter's family, of course. This has been a cancer that's been kind of going on and kind of plaguing the African American community since about 1989, and it's kind of interesting to actually have a program like this in place to where we're actually available to assist some of these young people as they're making this transition in their lives. True indeed, the communities that they live in are kind of plagued with the violence, and a lot of these young people really don't want to be involved, but unfortunately, these are the only means that they know of survival. I was one of those kids at one point in my life, and if certain things didn't go right, I wouldn't be standing here right now today. A lot of these guys, from the shooters to the victims, are looking for people that they can reach out to. And unfortunately, due to the circumstances of the communities that they live in, when they reach out to people, they only get the negative. So a lot of the negative behavior is then influenced, and then some of these kids actually exceed some of this negative behavior just to meet the expectations of the communities that they live in. They want somebody positive to talk to. At the end of the day, by having somebody positive to talk to, we give these children options to better their lives. And not only do we service the children, but we also service the young adults, because unfortunately with the community that we're servicing, a lot of the young adults still have the same mindset of those that are teenagers because of the lifestyles that they live. I think it's very, very important that we continue to do things like this to kind of bring the intervention in, and also instead of allowing this cancer to grow. By us talking to some of these people, these active shooters, these gang members, these people who have actually just been on the brink of losing their lives, that one person that we speak to is able to go back into their community and then affect 10 to 15 people that they come into contact with. We started 2 months ago. I feel as if we did not start this program 2 months ago, there would have been an increase in violence during the month of August due to a lot of the gang and the street beef that has been going on. We have had innocent victims that have come into the hospital who are victims of these gunshots. We've had children who have been affected. I'm actually working with a young man right now that I feel like if I wasn't working with this young man right now, he probably would, ultimately either be shot again or he'll either be in jail. By me spending time with them, I'm actually giving them something positive to look forward to. As you guys may know, and as everybody in this room may know, in these communities, there aren't many positive male role models. A lot of the times these kids look to the videos, the music industry, athletes, people who are not actively in their lives to kind of base their lives off of somebody else's. By giving us this opportunity to keep Next Step in the hospital, we are giving these children positive role models that are immediately involved in their lives. I believe that we are actually making a huge difference. If there was no Next Step, there'll probably be more victims of violent crimes throughout the city right now. We have diffused a few situations in which, unfortunately, 2 feuding parties both end up in the hospital. By speaking to one member of this party and another member from a different party, we're able to kind of reduce that, because these 2 gentlemen are now spreading some of the positive influence that we've given them to the people that they are now involved in. By us treating this like a cancer, because it's really a cancer, we address the immediate families, we address the friends, so we develop a stronger support group for the people who are actually impacted from the wound, a penetrating wound, a gunshot, stabbings. And I believe that it's extremely helpful. I don't know.
So I have a question.
Sure.
What kind of services or things do these individuals want or ask for? And are there things that they want and need, or they say, if I just had these, I could change my life, that we can't offer?
I would say that 90 to 95% of the participants, while they're laying on the bed recovering from that gunshot wound, the only thing they want is a job. They need means to make money. That's pretty much the sole reason why a lot of this madness is going on, is due to the lack of employment and then due to the lack of education. And then we are criminalized. The young men are criminalized, and they fall into a system that really does not help them, and it actually holds them back from becoming the individuals that they truly need to be inside the community. So,
Do you feel like you are able to connect them with anything that would get them closer to getting that job that they want?
yes. Immediately, as soon as we meet them, we do an intake, and we kind of find out what it is that they feel that they're missing in their lives. Dealing with some of the youth get involved in some of the things that they get into just because they don't have new shoes. You know, it gets down to like some of the bare minimum, some of the basic necessities that most people are able to kind of provide for themselves, but due to the environment that these young people are growing up in, they don't have the means to get the things that they want. So they act out in ways that usually ends up with somebody getting hurt because of $70 or $80 worth of gym shoes. It's a very interesting field to be in. I mean, when you come into a hospital and you see something, you hear about it all the time, people getting shot all day, but when you actually see somebody laying on that bed recovering from a gunshot wound, you realize that they're just as human as everyone else. And if they had the means and if they had the resources, a lot of this wouldn't need to be happening. So with Next Step, we're offering these gentlemen and these young ladies the resources to help them guide themselves back onto the right path, because at the end of the day, that's the only thing they want. They want to feel safe. They want to be able to make money and take care of their families or take care of themselves in a responsible manner. But due to the way the system is set up, a lot of these young people fall through the cracks and they get involved in things that are negative.
Thank you. Councilmember Fry has a question too.
Thank you, Mr. Chair. And thank you, I'm sorry, I forgot your last name.
It's Shahir.
Shahir?
Yes, sir.
Thank you for your presentation and your work. Just a few questions as to how this works practically. Some of them I know the answer to, others I don't. Someone that you work with gets a call at, say, 2 or 3 in the morning. There's been a gunshot. There's an individual lying in a bed at HCMC. What happens? You get the call, and then someone immediately goes down there. How does this work practically?
Okay, so case scenario, young lady gets shot. She's driving down the street, ends up with a gunshot wound while driving. Her car past an intersection, has nothing to do with anything that's going on, just happened to be at the wrong place at the wrong time. They send out a red alert. The red alert goes to the case manager's phones at the hospital, which then lets us know what exactly is going on, the age of the victim, the sex of the victim, the nature of their wounds. And we have 30 minutes to get to the hospital. We get to the hospital. Normally the patients are inside the stabilization room. And
this is our employee that's then heading to the hospital?
Yes.
Like the city's employee?
The city's employee heads to the hospital, meets the patient inside of the stay room. We get the label, find out the incident, where it happened, the location. The patient is then either taken to the OR or taken to a CT scan to kind of see what else is going on. They're admitted into the hospital. From that moment, we're making contact with the patient's family. We're making contact with the patient's friends and everybody else that comes down to the hospital to visit the patient. Within those first 30 minutes, you can hear the retaliation that's going on or the planning of the retaliation if there is any being planned. We are there to provide those visitors, that family, those friends with a support system that lets them know that retaliation is not the answer and that there are other ways that we can solve this without having somebody else getting hurt. By speaking to all those people, we're affecting not only that one person that's in the hospital, but we're affecting at least 20 to 30 people that they may know. We reduce the retaliation. We talk to the family. We provide a visitors list because sometimes the hospital can get chaotic when a bunch of people are showing up at the door. It makes everybody uncomfortable, especially the security, the state troopers, the nurses. Everybody becomes uncomfortable. So we're there as a liaison to kind of go in between the families and the staff to kind of reduce the tension that the family may have with the staff just because of their differences. The patient will be admitted upstairs. We do follow-up every day that the patient is in the hospital. We monitor their recovery. We ask them what it is that they need, what it is that they feel they're missing out of their lives. We develop that case plan, and then we start sending them to the places that they need to go. We also offer therapy for those that may need physical therapy or mental health therapy.
You know how many cases we've had since July when it's been started?
There have been over, I would say, 60 cases as of this weekend. This weekend was a pretty busy one. Labor Day weekend was another busy one where the influx of people was like maybe 6 or 7 patients came in a night.
And how many caseworkers do we have right now?
We have 2. We have 2 that are based in the hospital, and then all honesty,
And you're one of the 2.
I am one of the
Okay.
2. If we did not decide to go home, we would actually be living in that hospital because it's an ongoing thing. Every day, people are being discharged. People are being admitted. You have family members that are showing up at all times of the day. You have care plans that need to be developed, follow-up therapy that needs to be taken care of for these patients when they're discharged. You want to be there when they're discharged. Sometimes they kind of slip through the cracks because there's only two workers at the hospital. But for the most part, we stick with them. Out of the 60, we probably have about 15 active participants. We do keep contact with all of the participants, so we reach out to them maybe once or twice a week just to kind of touch bases with them and see where they're at. Some people decline the services that we offer because they have legitimate jobs. But the ones that do not have the legitimate jobs are the ones that kind of cling to us. We have young men that cannot work that want to be able to take care of themselves, but unfortunately do not have the skills or the educations to obtain those jobs. So we get the gentlemen or get the young ladies the training that they need. We refer them to places like Urban Ventures or Emerge to get job training. We send them to Summit Academy for job training. If they need GEDs, we send them to Sabathany. If they need free food, if they need food for the house, pretty much any and everything that we can do to possibly change their perspective or change their life is what we're willing to do to help them.
Thank you very much.
Thank you very much. All right, thank you for your work.
Thank you.
And I just wanted to clarify, I don't know that the case managers are actually City of Minneapolis employees, but I know that they're contracted through HCMC to provide services, so they're essentially working for government. So just, I know
Yeah,
that makes a big
nice.
difference for us up here. They're not actually City of Minneapolis employees. We've got grant funding so that we can provide the funds, so that we can have the case managers, so they're sort of working for us in a partnership with HCMC. And Josh or Sasha can clarify, but it doesn't make much difference to the case managers, I think, but we just whether or not you're a city employee is sometimes a big deal.
Where does the grant funding come from?
Pardon me?
It's from the grant funding's from the state. So it's from the state, it's administered through the city, and then the HCMC is the one that actually pays your check, pays your bill.
We're affiliated.
Well,
The department code that we go through is 5380. It's actually the security department at Hennepin County Medical Center.
Okay. Maybe Josh just can clarify.
Good afternoon, Mr. Chair and members of the committee. So we have a combination of state grant funds from the Department of Public Safety, Office of Justice Programs, and then some city general funds as well. So in the 2016 budget, there was $25,000, and we had a $50,000 grant from the state. We just secured an additional $140,000 grant from the state that runs from October 1, 2016 to September 30, 2017. And Councilmember Gordon is correct. So we have a contract with HCMC, and our 2 case managers are employees of HCMC.
Thank you. Excellent. And I think we have more questions. It's not very often we can get somebody with your work experience here to help us better understand what's going on in our city. So Councilmember Johnson.
Thank you, Mr. Chair, and thank you, Mr. Shahir, for your work. It sounds very impactful and important. One of the things you mentioned is around